We know that the unemployment rate and families have been adversely affected because of the pandemic, which creates a whole new need that they may need to access that they didn't even know about before. So having a clinic available to them is key to wellness, health, prevention, and chronic disease management.
If we did not exist, there would be a whole group of patients that would be basically showing up in emergency departments with nowhere else to go. And I think the pandemic illustrated the need for those who were a little bit skeptical about free clinics, because it was apparent that you didn't really want folks sitting in the emergency department unless there was a true emergency.
We have seen increases in demand for our services due to the pandemic, and certainly as we're coming out of the pandemic, and our dental practice has seen the most demand increase. Folks are realizing, hey, it's been a couple years since I've been to the dentist and I need to get back on board with this. Then they go look at the private sector and it's like, oh man, it's $225 when you walk through the door for your exam and x-ray. That gets really tough when you're talking about somebody who's at 150% of the federal poverty level or 200% of the federal poverty level. And if you don't have insurance, that comes out in real costs that have to come out of pocket. So any inflation is absolutely adding a barrier to access to care and really makes it prohibitive for folks.
I think that's what's so important about free clinics, is that we work really hard to meet those needs and to be available wherever those folks exist, which is why I think even during the pandemic, how we were able to obtain a video translation machine when you think about health equity for our patients who are not English speaking. We also converted to telehealth to try to figure out ways to support the need no matter what.
Clinics can offer these services that are going to provide a holistic approach to wellness so that families can live their best lives.